I'm Kate Wakelin, and thank you so much for having me along. I'm not going to labour... Oh, we're back? We're with... Okay, excellent. So this works in, I think, dovetails really nicely into the previous talk that we've just heard. I wanted to talk a bit about life with and beyond nets. So there's lots of stuff that we know already. We've seen some of these stats or very similar stats. This is the data from the Oceanic study that was done in 2014. So we know, we see lots of health professionals over lots of visits before there's a diagnosis of neuroendocrine tumours, and the delay in diagnosis is well known and well documented. And probably as a bit of a result of that, we know also that a lot of people have nets beyond where it started by the time they find out that it's actually a net. We also know that more than 50% of people are misdiagnosed with something else. I always like to do this. If you put your hand up if you've had a different diagnosis before you had your neuroendocrine tumour diagnosis, and most people I speak to, they've been treated for anxiety, depression, menopause. So we know these things. Common issues, so delaying diagnosis, an ongoing burden of symptoms, so whether it's syndrome or issues related to treatment, and also a huge disparity, and none so significant as living in New Zealand without access to lots of the things that we take for granted in Australia and in the UK. There's lots of things that you're fighting for that you should have. But also location. If you live regionally or rurally, it makes it even more complicated and difficult to reach the services. And then there's the psychosocial impact of being diagnosed with something really quite serious, as we've just heard. But there's some good news, and we've heard some good news, and there's some good news coming where we'll be looking at, what's happening in research. We're finding more and more about neuroendocrine tumours all the time. There's new papers coming out, there's new clinical trials. We're really kicking goals treatment-wise. Increasing numbers of people living longer and longer with neuroendocrine tumours. And, some of my patients have been living with their disease for 10, 15 years and beyond. So where does this leave us? We're told at one hand, you've got cancer that's advanced, you've got tumours, and we look at the PET scan, it looks like you've been to a paintball convention, you look like Dalmatian, it's 101 spots. So it feels, and it's cancer, it's advanced, it's not curable often, but then it's great. We're controlling this, we've got long-term control. So where are we in all of this? So a lot of people feel like, okay, I think it's a thumbs up, it's not as bad as if it was the other pancreatic cancer. But on the other hand, we're all wondering, how long is this piece of string that we've got? And there's the ongoing impact of just living with that uncertainty. And often we get to a point where the paperwork, our lives are a big chaotic pile, and we're trying to sort through and make sense of not only the logistical and the physical aspects of what's going on, but also the emotional aspects. And that can lead us all feeling a bit unravelled. Sorry, I did pinch that. So I guess that brings us to a concept that we've been talking about as health professionals for a very long time, but more in relation to cancers that have been more considered to be curative. So these are words that you'll hear in breast cancer or bowel cancer, where someone's had an operation and chopped it out and maybe needed a bit of chemotherapy, and that's finished, and now they're looking at the rest of their lives. And it's called survivorship. And we used to not think about survivorship when we were talking about people where there was advanced disease, but more and more we're realising that, especially in nets, where that piece of string can be really long. It's a piece of strong. That piece of string can be really extended. The sorts of things that we want to think about when we're talking about survivorship in nets are side effects of treatment. So anyone who's on somatostatin, on the sandostatin or lanreotide injections knows that most people get some kind of side effect. So even if your tumours are stable and not producing and, they're kind of playing the game, then there can be the ongoing effects of treatment. Needing to coordinate follow-up care. And often it's not just the appointment with the doctor, it's all of the other allied health people. It's going to scans, seeing the GP, all of that sort of stuff. The emotional implications, as we were talking about. But also legal and financial concerns. It's really difficult to plan your life when you don't know how long that piece of string is. Most people, when they're diagnosed with a cancer, they're 55 and over, but I've got patients who are much, much younger in Australia. I'm sure there's many patients here who are much younger too. And so even if you're thinking about, well, my prognosis, I've got people who, my doctor's telling me that they've got patients who have been surviving for 5 or 10 or 15. Gosh, that makes a difference when you're thinking, well, do I quit work, or do I struggle through work, or do I quit work and do the bucket list? But if I spend all my money and I'm only 40, well, that's not going to work so well either for me. I lost my job. My boss found out I had cancer, and I was very conveniently retrenched. So the legal and the financial concerns, that difficulty in planning. But also, if we're going to live for 10 years with nets, maybe we need to be thinking about having mammograms and pap smears and preventing type 2 diabetes and all of the other things, charming things that happen to us as we get older that we're at risk of. So it seems a terrible pity to control the neuroendocrine tumour only to come from something else that's completely preventable that we've kind of forgot about. So we've been working, the Unicorn Foundation in Australia have been working on a project looking at a concept called survivorship care plans for people with neuroendocrine tumours. And this is a new thing. Survivorship care plans, again, have been used in other sorts of cancers, but not to our knowledge in NETs. And it's basically, they're fairly simple. It's a treatment summary. So it's a document that says, I've had this treatment, and I've had, sandostatin, I've had some carboplatin and etoposide, I've had some external beam radiotherapy, So it's a treatment summary. But it's also for you as the person who holds the survivorship care plan, it's a list of things like side effects and symptoms that we want you to monitor and report. So a lot of people ring me and say, I've got this issue. My scan's not until, 9 months' time. What do I need to do about this? Do I need to be worried? So this is designed to be a document where you've got that written down. So gosh, if I get 6 months before my next PET scan, I'm getting lots of flushing and diarrhoea that's new. Probably need to see the doctor about that, make an appointment. And it also tells you who you need to ring about that. A schedule of lists of tests and appointments. And, you saw that big pile of papers, the image of the big pile of papers. I know lots of people say to me, I feel like I need a personal secretary to look after all of this stuff, all of these appointments, all of these tests. And when it's been going a lot of years, it can be even more mind-boggling. The contact details, as I mentioned, of the people to call, but also really importantly, the support services, so that you know where your support's coming from. So we've been working, as I said, on this project, the NET Treatment and Wellness Plan project. And you'll notice there that I haven't called it a survivorship care plan project, and I'll tell you a bit about why that is in a minute. So it's been a collaboration between the Australian Cancer Survivorship Centre and the Unicorn Foundation in Australia. The Australian Cancer Survivorship Centre is it's a philanthropic funded branch of Peter Mac. Is probably the best way to describe it. Is that what works? So, and what we did was, and they did an initial study to determine in lots of different cancers, but particularly they looked at NETs in terms of, what information do people really want on a plan like this? What sort of delivery format? So do people want it on a phone, or do people want it on a computer? Do they want a data stick that they take home? Do they want a piece of paper, a book? And, how would people use this? So they did a study a couple of years ago looking at this. and what we found was that A was highly desirable, and I see this in the worldwide literature and conversations over and over again. But importantly, they didn't want it called a survivorship care plan, and that's because people with NETs, especially when they're living with advanced disease, survivorship and being a survivor is not a word that really fit. And that might be different in other countries, but certainly in Australia, people with NETs where they're living with it in an ongoing way, that's not a word that worked for them. So that's why we changed the terminology to become a treatment and wellness plan. And what they wanted was a treatment summary, a list of symptoms to watch out for, tests, what and when, list of side effects. That's pretty much the hallmark characteristics of a survivorship care plan that we talked about before. And really importantly, who to contact, who to ring. So we've spent the last 12 to 18 months building a template, building a tool, and we've developed a template. And the way it's going to work is that it's a customisable document. It's actually a very simple document where you can delete fields or add fields in according to what's happening for you. That's been through a process of, we built it and then we sent it out and said to a whole bunch of health professionals, tell us what you think, and we sent it to a whole bunch of our consumer advisory group members. So these are people with NETs or having cared for someone with NETs, and said, what do you think, what do we need to change? And we got lots of changes, and some of them said change it this way, and some of them said change it the opposite way, and some people said that bit's perfect, and other people said that same bit, no, that's off. So anyway, we've tweaked it and reviewed it, and we're at the next step of piloting it, and that's our next stage. So the idea is that this is going to be a resource that's housed on our website, available internationally, and you'll be able to download it. And then ideally, your health professional will help fill it out. But one of the things we know about these plans from our experience in other sorts of cancers is that our health professionals have got a lot on their plate. And so it's also meant to be something that you might actually fill in yourself or in combination with your health professional. So it's a bit of a watch this space. We're hoping to have something out in the not too distant future that you'll be able to hop onto the website and download. But hopefully it'll be a little bit more than just a fill in the dots or colouring in project. But so I just wondered if there are any questions. I know you're all hanging out for afternoon tea, which is enticingly waiting for us at the back of the room. But
thank you, Kate. Any questions? We do have time for questions, so don't feel pressured not to if you want to. No,
I just wanted to make a comment. That would have been perfect when I was on holiday in Auckland and got admitted to hospital and they couldn't see my records of Christchurch. So other people have found themselves, if you're in some places in the country, they can't access your records. So I had to explain to the emergency doctor what neuroendocrine cancer was.
So your comment, Katie, I love your name, Katie, was... Yeah, of course, from our website when we get it out. But yeah, when you're travelling, particularly, or if, and people do, when you're living for a long time with this, you might move house, you might move GPs, you might decide to go to Europe for a holiday, and you can take this with you, and it's got, hopefully, pretty much everything you need.